Awesome. How is everyone?
Doing great yourself.
Good.
Good.
Okay, so yeah, we'll kick things off just to stay on schedule here. So the Canadian market, we just celebrated our 1 year for rec. There was a lot of speculation this time last year on the edibles market as it wasn't included in the initial Cannabis Act. With Health Canada recently releasing what's, I guess, been coined legalization 2.0, with a lot of focus on edibles. I just want to kick things off, and maybe we'll start with Sandra. Sandra, what are some of the key points that companies should know with respect to legalization 2.0 in Canada?
That's the introduction of the cannabis edible market. I think one of the things to be most concerned about are the rules and regulations and restrictions around packaging, labeling, promotion, and branding. The earlier legislation, the Cannabis Act, which was passed October of last year, carried with it a number of significant restrictions and rules around branding and advertising and promotion. Those are equally applicable to the cannabis edible market as well, with some new restrictions. For example, there's new health warning messages which must accompany the packaging in relation to the edibles. There's also new standardization quantities around THC, CBD, childproof packaging, that's still the same, and limitations on the size of your logos, for example, in text on any kind of promotional activities. I think in addition to the packaging and the labeling restrictions, no bright colors, no health claims, no dietary claims, no nutritional claims, no cross branding, and that's one of the biggest things we're seeing now in relation to the alcohol and tobacco interest in the edible market. For example, no reference to Chardonnay or IPA brands, those sorts of things. So wherever you see a restriction in place in relation to your packaging and your labeling, those will also apply to promotions. Or basically anything that's appealing to children is prohibited. So no appealing flavors, there's no sugar, no alcohol, no nicotine, no caffeine, no promotion. But one of the biggest improvements, I think, or latitude that Health Canada has given is that now packages will be allowed a peel away label. And so now industry can put in information within those peeling labels.
Okay, thank you. James, Hexo has a dog in the race, no doubt. You talked a bit about trust beverages. What's Hexo's view, or even your personal view on these new regulations?
Well, I mean, the new regulations are they are what they are, right? And that's the world that we live in. It's a very tightly regulated environment. We have to always be concerned with making sure that first and foremost we stay 100% legal. And then of course the next thing that we're 100% concerned about is the safety of our consumers. But really, when we look at this, we want to be able to provide a product that consumers can identify with. So, ideally, in a perfect world, I would love to be able to have more freedom from a point of view of labeling and more freedom from a point of view of branding and being able to communicate the product, right? How fantastic the product is. When we come to beverages as an example, it's a great way to be able to normalize cannabinoids and the use of cannabinoids, whether that's a THC product as a relief, from the end of the week type of thing, just as we would consume alcohol, or it's a CBD product that provides the ability to be able to, have some form of a recovery from a sports event or from, some form of strenuous activity. The environment that we work in is one that we have to comply with all of these regulations, and I think what really comes down to it at the end of the day is consumers are going to choose the products that they feel comfortable with, the format that they feel most comfortable with, and then at the same time they're also going to lean towards those products that give them that fantastic experience, right? We always talk about the way to bring products to normalize them as being, make it a simple, easy experience for the consumer, right? Make it simple for something that they're already familiar with. When we talk about beverages as an example, we want to make that a normalized experience. We want to make it something that is similar to the experience that they've had perhaps with alcohol, so that there's not ability to be able to consume multiple beverages, right? As opposed to some of the beverages that you might see in the States where there's, a huge amount of milligrams, on a per bottle basis. We don't want the consumer to have one and be done. We want the consumer to be able to enjoy that product over a period of time. And I think that's where we're going to see the Cannabis 2.0 products evolve towards, right? Is that ability for it to be normalized and be easy for consumers to use.
Thank you. Paul, you didn't get a chance to introduce yourself. So do you want to give 60 seconds on who you are, and then maybe segue into, whether or not, if you can just educate maybe the audience a little bit, whether there's max requirements for THC in the new edibles and the regulations.
Perfect. Paul Peterson, co-founder, CEO of Next Leaf Solutions. We have been around for about 3 years now. Our focus has been developing disruptive intellectual property around extraction, purification, and formulation of cannabinoids. Currently own a portfolio of 8 issued and over 40 pending patents around the production of THC and CBD distillate, which we think is the precursor for edibles and beverages and all these 2.0 products. We really believe that for 2.0 products to be successful, especially beverages, that the experience has to be good. And when you talk about experience, really 2 things: onset time and taste. We think that traditional infused beverages, if you go down to the United States, I think across the board they're terrible. They're terrible because they're manufactured with a less refined THC molecule. So you taste chlorophylls, you taste waxes, and you get that plant taste. So that's the first problem. The second is the onset time. We've been very focused as a company on developing and acquiring technology that we think is going to fix those 2 problems. So first, we believe that when you start with a high purity molecule, you start with a tasteless, odorless distillate, you're going to be ahead of the game when it comes to taste, and you're able to flavor it, and consumers not tasting the fats and lipids. 2, we've been very focused on a technology that we've just recently acquired. It increases onset time from about an hour and a half down to 10 to 15 minutes. We think that's a quantum leap for the industry because I think, to compare it to alcohol, if beer took you an hour and a half to feel the effects, beer wouldn't be as popular as it is today. So that's those are kind of 2 big problems that we're working on. Just very excited now for the opportunity with all the 2.0 products, and we think that it's a whole different skill set as a company. I think the last 5 years, the industry has been about growing plants and how many millions of square feet you have. And so now I think getting into the 2.0 products, it's all about technology and manufacturing capabilities and companies that can win on cost, because I think that's how the legal market beats back the black market, or the illicit market is a better term, is being able to win on price. So that's sort of our view of it.
Interesting. Okay, you brought up very interesting points. I mean, 2.0, it sounds in your view that the focus is now going to be on the technology rather than, this time last year, a lot of it was about cultivation and companies, getting new licensing. To pass it over to Sandra. Sandra, when you see these regulations, what are some trends that you are seeing on your end that, are some messaging coming from Health Canada, especially with how they see the future of the cannabis industry here in Canada, especially to James's point, when brands can't tell their stories and they want to get access to the consumer. What's Health Canada's, more or less, what's the message they're putting out there based on these regulations?
I think first and foremost, Health Canada is going to be concerned about health and safety. It's always been about the product and ensuring that the consumer has a safe experience, its quality across the board, its consistency, and it's, when the task force initially developed the first set of regulations, they were guided by a set of principles, and those principles, focused on safety of products, safety of the individual, preventing young people from accessing cannabis, whatever product that may be. So if it was the first set of cannabis, or the first forms of cannabis, whether it was dried, flower, fresh, now we're going to see the same regulatory framework, the same restrictions moving into the edible market. I think that appears to be their focus, right? And I think as new products come on the market, they're going to approach it very carefully, and that's why we're seeing a stepped or a graduated approach into allowing certain products onto the market, and restrictions around those ingredients that can be used, or infused into these products until they know what those products will do, or how they will affect an individual. And you're also seeing that in relation to the inability to make any claims associated with any of the products, whether it's a CBD product or if it's dietary supplement, or if it's a therapeutic claim in relation to a CPD, they're just very cautious as to what you can say about the product until they have more scientific data to back up and substantiate these claims. And this is what you're sort of seeing, I think, in the vaping market now is the uncertainty around, inhaling some of these products into your body and into your lungs and what that may actually do. So they're just approaching things cautiously, and I don't think that's the wrong thing to do.
Thank you.
James, just want to
sorry,
add
Paul.
one point about the vapes just quickly. I think one thing very important to point out, though, all these issues with the vape products, we're not aware of one instance where there's been issues from legal vape products. These are illicit products, and I think they also speak to the need for regulation. And obviously in Canada, vape products aren't legal for sale till the end of the year. And what we've seen in the United States is products that come from the illicit market that are unsafe because they're made in unregulated environments with carriers and so forth. So I think it's going to be there's going to be even more focus from Health Canada on the products that producers put forth to have approved.
I would agree for sure. James, I know you're heavily involved on the M&A side for Hexo. So you're out there scouting new opportunity. What's the new opportunity that you see in legalization 2.0 from an M&A business development standpoint?
Yeah, so I've really got to agree with Paul in that the market has changed very quickly over the course of the last year and a half to be focused around technology and around what can we do next, right? We've said now for a number of years that we don't intend to be a cultivator forever. Winning at this game as a cultivator, as a farmer only, it's not going to make it. We need to look to where are we going with this product. Being a cultivator today is important because it's a barrier to entry. It's a first step in the Canadian marketplace. But as we move out into other marketplaces, we look to expand into the US or into EU or into to Latin America, it's about the technology that we need to leverage. And that technology is not only in delivery of the beverage, but it's going back to, again, to Paul's point, it's starting off with that perfectly clean, pure substance that we're now going to formulate with. So we're constantly out there scouting for technology. We're looking for new opportunities to be able to reduce onset time. But at the same time, it's not just about onset time. We're spending a lot of time worrying about offset as well. If the consumer is looking to be able to have an experience that allows them to be able to ideally feel the effects of the product within 5 minutes, I mean, that's really where we want to run towards. We also want to be able to predict what that offset is going to be. That consumer is not going to want to experience a gummy that onsets in 5 minutes, but then offsets in 8 hours, right? And maybe some people do, but realistically, we want to be able to have it predictable, right? So that we do know what the time frame is going to be. So we spend a lot of time worrying about that. We spend a lot of time worrying about the type of technology that allows for the product to be that absolute perfect, consistent consumer packaged good type of an experience, right? Every time I go to the shelf and I pick up that cookie's got to deliver that same experience, time in, time out. Same thing every time I have that vape experience has got to be same thing, time in, time out. Our formulations that we're working on are leveraging those technologies to be able to deliver that experience, right? Whether that's an experience of being able to help you sleep, an experience of being able to provide you with euphoria, or an experience that helps you to be able to be calm, whatever it may be.
Interesting. I mean, and I think that's one thing we can say for certain is one of the opportunities for companies looking to access the Canadian market is, an import of technology. And maybe Sandra, I'll pass this over to you. What is the likelihood that Canada will, when we talk now about flower, an actual product, is there some, are we seeing any rumblings from Health Canada, any signs that, Canada will improve import access of products into Canada?
I think that's the $50 billion question at the moment that everybody seems to have. Our regulations and our legislation allows for the import and export of cannabis. It's there, it's clear. It's for medical and scientific purposes. The information that we have is that, even for importing for R&D purposes, it has to be medically focused, Having said that, why are we not seeing much import, from other countries where they are producing? We have seen some product coming in from Jamaica, Colombia, Israel, but not in any commercial scale. So I guess the question really is this a supply and demand issue? Is this a product safety issue? We're not quite sure exactly where Health Canada is coming from because we don't have any policy around that, legislative framework that will say, we're going to allow in certain products from certain countries. I have no answer to that one. I wish I did, but I think it's a problem or a challenge that Health Canada is going to face when industry is looking at cultivating and growing in other jurisdictions as part of their global strategy. And I think there's going to have to be some further clarity in the future.
Okay. It really is a commercial aspect, right? You touched on it there for a second. There's got to be a commercial requirement, right? And the fact that it's for a medical purposes only, the medical marketplace in Canada is still relatively small. So the current cultivation assets that exist in Canada can supply that without the requirement for additional demand. If we look at it for ourselves, our medical business is only a small portion of our overall business. The majority of our business is really focused in on the adult rec, and adult rec is where 95%, even greater, of our volume goes to. So we don't have a need necessarily to be able to import. Having said that, as the Canadian medical market grows and we get into an environment where perhaps CBD becomes less regulated and is now more commercially available on broader distribution shelves. I mean, let's be real, right? Today, the Canadian marketplace only has 500 some stores. 278 of them are in Alberta, right? 60% of the marketplace only has less than 100 stores. So access to the product is limited from a recreational side. From a medical side, it's still going through normalization. We still don't have enough doctors that are out there, readily prescribing and really using it, turning to it as a form of therapy. So, the market's still got to develop. It'll take some time.
Mm-hmm. Agreed. Okay, so we do have a question from the audience. This is from Boris. And I'll just read it off and maybe Paul, I'll send it to you first, just see if you have an opinion on this. So in your opinion, we will see that the nutraceutical OTC category evolved following the latest consultation by Health Canada for non-practitioner oversight. If we do see that coming, what expanded role for pharmacists will we see, and do we think we will move to adapting cannabis to scheduling as per NAPRA regulations, or do we think that new regulations will be needed to be created in order to allow cannabis products into the space? For example, cannabis health product number versus an NPN versus a DIN. And I'm not sure, Paul, if you have an opinion, or maybe Sandra.
Yeah, no, I think great question, and James sort of alluded to this a moment ago. The cannabis health products, which the government, put out for comment back in June, is very, very significant, because we believe that if Health Canada says, okay, low risk cannabis products, which we would assume they would mean CBD only products or very low THC based products, could be sold kind of over the counter like vitamins. We think that has the potential to really fix the distribution problem that James is talking about. I mean, there's a lot of challenges that the legal industry has right now, and the reason that the legal industry is maybe 10% of the total, supplies 10% of the total cannabis market is that the biggest problem is there's not enough distribution. So if you could sell CBD-based products kind of in every Shoppers Drug Mart across Canada, for example, that would change, at least for CBD-based products, the distribution. And we think it has the potential to really blow the lid off this industry. And at the end of the day, I think CBD is certainly a phenomenon. I've seen it being in this industry the last 6 years. On the medical side, I was previously at Peace Naturals, and CBD oil over the last year has been has been very popular, recreationally, and we think at the end of the day, consumers want to buy legal products. It just comes down to having availability for those products, and obviously regulation and a lack of retail is a big reason for that. And as far as DIN numbers go, I think the challenge, we've seen it with GW Pharma, and I think we've seen 2 drugs now with DINs in the US. The issue is cannabis flower will never ever have a DIN number. right? The reason is because it's not standardized. You know, when you grow lots, there's too much variation. Where you're going to see DINs is an oil-based derivative products that you can standardize for dosage and have the same amount of cannabinoids, the same chemical profile from lot to lot and drug to drug. So I think we are going to see cannabis-based drugs with drug identification numbers, DINs, in Canada. Is just again, it's going to be on the oil side, and I think I don't know how much of a focus companies are taking on that, but it's certainly an area that I think we'll see growth in.
I have to agree with you, Paul. The regulatory framework around the CBD products is lacking, and the consultation paper put out by Health Canada, recognizes that there has to be a new pathway in relation to CBD products with a less than 0.2 or 0.3% THC, and so it'll be interesting to see what comes out of that, because if you look at even just the World Health Organization, they clarified very recently that, anything CBD derivative, is not regulated on the international arena like a narcotic or cannabis is scheduled on the international drug treaties. So, if that is any indication, that CBD, based on their scientific research, is not harmful to Canadians, why is CBD regulated the same as cannabis containing a high THC content, right? So, there has to be a new system developed for these kind of products in order for Canada to compete or even maintain its leading edge in relation to that market. I mean, we see the US, for example, even though cannabis is illegal federally, they've now passed, the Farm Bill, which allows CBD products derived from industrial hemp, legal federally, which allows for interstate commerce, and it allows for importing and exporting. As soon as the FDA issues their regulations in relation to the CBD derived from hemp, then that market is completely opened up, and Canada will be at a disadvantage because the CBD that's even derived from industrial hemp plants are regulated the same as cannabis with a high THC content. But it just doesn't make any sense in the market.
Thank you, Sandra. On that note, I have to wrap up. We need to move on to our fireside chat with Alex. Just to conclude, thank you, James, Sandra, Paul. Really appreciate your time. Perfect. Alex, how are you?
Good, Grant. How are you?
I am well. And just before we kick off, I just want to let the audience know, I think just because we are running a bit behind schedule, we might cut the break a little short. That way we can kind of pick up that time towards the end of the conference. But, so segueing now, Alex, we're going to be talking about international investments and capital and some of the challenges that the equity markets are seeing. So just to kick things off, what are the common challenges in completing an M&A deal in the cannabis industry today?
There's a number. We've seen a lot of M&A activity last year, especially since after legalization in Canada. So 2018 was a very busy year, a lot of deals being done. 2019 also started pretty busy. We've noticed a bit of a slower period now, starting in September or in August. But there's a number of challenges. Looking at a target that's involved in the cannabis industry, there's just so many issues that these companies touch. So it's really important to have an advisor or a legal team in that local jurisdiction where that company is domiciled that really understands the laws and the regulation and the rules relating to what's required to operate a cannabis business. If it's a cultivator, if it's a house of brands, if it's a company that's focused on IP, or if it's a company that is affiliated with others or just does business with others that are in the cannabis industry, it's really important to understand what laws they are subject to. Are there contracts that they entered into? Are they compliant with the local laws? IP is very important to understand that they own the brand that they're promoting. If they're a cultivator, are they licensed properly? So the cannabis industry just permeates so many different areas of law that it's the most important challenge is getting the right group of people in your that really understand the local framework of the target that you want to acquire. And I'm saying this from the perspective of a buyer in an M&A transaction. In terms of a seller, it's making sure that your financial documents are properly organized. You have the right controls. That your contracts are readily available for due diligence review, and just basic corporate cleanup and corporate governance, which would be important, especially in this day and age.
That's interesting. And I wonder, are you speaking a little from experience where, are you seeing clients coming to you without, having tried to more or less do it on their own and realizing, wow, I have no idea what's going on in a regulatory framework here. I need help.
Yeah, that's very common, especially, and it's not just cannabis. It's any emerging industry. You have people that, with good intentions, trying to start a business. They have a great idea, but they have never run a business before, and they have a lack of experience in proper record keeping, proper corporate governance, or what it takes from a legal perspective to manage and operate a business that's compliant under law. So when we get involved, it's possible, and I've seen it, that these companies have been operating for years, but they really haven't had proper counsel in advising them to prepare their documents a certain way, to have proper record keeping, and that's very important, especially if they want to raise money or if they want to start going through an M&A process with a buyer or a seller.
Interesting. And so maybe that actually brings about the next question. So, with all the options available for cannabis companies to become funded, where are you seeing some of the more successful trends today? Like how are these successful cannabis companies being funded today?
Well, it really depends what stage the company is in. And I've seen companies in all sorts of stages, from a startup to a company that's just started to generate some revenue. And then there's companies that are ready to go public, and then public companies, how they finance. It's really, getting their good friends and very close business contacts and getting a seed round together so you can take the company to the next stage. Once you get to the next stage, you see more sophisticated investors that would ask more serious questions about where the company is going. I want to see your records. There's a due diligence process. Often they would ask for a board seat for the company for a number of years. The private company then evolves. Maybe there would be some help with an investment bank in raising some money. And then eventually the company gets to a certain point where they're starting to hit a wall with their options for investors in the cannabis industry, and then they would look to going public. And that's a very long and can be difficult process for a lot of companies. But we've seen a lot of go public transactions last year in the cannabis industry, especially from the US coming to Canada on the Canadian Securities Exchange, and a lot of listings on the TSX Venture as well. So that's what's unique about Canada. There seems to be a lot of activity with foreign companies trying to raise capital in Canada. And at Miller Thomson, we've advised a number of companies that have gone through that path of raising money privately and then going public.
Interesting.
And then once the company is public, it would be a bit easier for them. It depends on how the market's doing in doing a brokered financing, preparing a prospectus to do a public offering. So there'd be advantages in that respect, being a public company, in having more options to raise money.
So for any companies on the line now that has considered an an IPO on either the CSC or TSX. Do you have maybe one piece of advice you would give them that they should know now before heading down that road that might at least help alleviate some of the challenges that you've seen in the past with other companies?
I would say the most important is to make sure that your financial records are done properly, you have proper controls, because a challenging aspect of going public is to go through an audit. And that audit could take a couple months, it could take 6 months, it could take even longer. So it's important that you have those records cleaned up, and so the auditor is able to understand them, because it'll go a lot faster. And a second element would be your just record keeping in terms of contracts, having that all organized, because if you're going public, more often than not, there would be a broker involved. They're going to want to do due diligence. So they're going to want to see all the records for the company. And then, obviously to make sure that, if you're a licensed company, depending on where jurisdiction you are, that the license is in good standing, because that's something that part of the due diligence process, the broker or the auditor even is going to want to confirm. And we've been seeing that auditors and brokers have been asking for legal opinions on whether or not the license is in good standing or not.
So I have a question actually that just came in from the audience. So in your opinion, how does the massive slump in LP stock prices affect the fundraising options for private companies?
Well, it's a huge, it has a huge impact. We had a tremendous amount of activity in 2018 and 2019, and the markets unfortunately have gone south a bit, and there's been a bit of a correction on the share prices for a lot of the companies. So it's like any market; it's going to go through ups and downs. Right now, we're in a bit of a down market. It is challenging for companies to raise money, even for public companies. But there's a lot of opportunities now. There's with Cannabis 2.0, there's companies can diversify. They can look at their business plan and make some changes. And then I'm confident that investors will come back to the table, if that later this year or early next year. It's just the changes in laws right now is going to, I think, spur some activity from non-traditional players in the cannabis market. If it's with new cosmetic companies, new beverage companies, and I know some have been already involved, but I think with the changes in law and bringing edibles and topicals and other derivative products, I think it's going to bring new players to the table, and I think that's going to spur the financing activity for the cannabis industry.
There's a lot more we can talk about on this point, because I think it begs a lot of questions as well with respect to institutional players, and when we start to see them play more an active role, and whether or not that's a conversation specific to Canada or the US or global in general. Alex, I want to say thank you, and we really appreciate your advice on all this, and your if I can now turn the conversation over to you. Just as we're,
thank you.
Yeah, thank you. Asim, just to kick things off, tell me a bit about yourself and your area of focus.
So like I mentioned, I'm a restructuring lawyer primarily. So I help companies or lenders, in this context, lenders deal with troubled loans and how to get their money back in a difficult situation. Ideally, in the best type of situation, you lend your money, they make their payments, and you get paid out by the maturity date. Oftentimes that doesn't happen. And what we're seeing is with the equity markets drying up a little bit in the cannabis space, I think there'll be a lot more focus on debt and raising money through debt. Companies still need to finance their operations, and those are really the two options that they had. So I think what we're seeing now is, so where I would help is a specialty is to help companies get their money back, but what it really does is inform kind of what are some of the issues that come up in this space when you are trying to get your money back when the debtor has defaulted on their loans, and what are some of the risks that you face, and how that might inform your lending decisions at the front end.
Yeah, and I guess with to the last conversation there with Alex when we talked a bit about the slumping stock prices with the LPs. Are there some issues lenders might be facing currently while lending to these LPs as a result?
So when we look at, there's very few public situations. For example, recently a receiver was appointed over one cannabis company, and Thomson actually acts for the receiver in that one. And there's been one, it's called the Companies Creditors Arrangements Act, or the Canadian equivalent of Chapter 11, and one company went through that recently. But when you look at the Cannabis Act and what's in there, and when you tie that with how you would typically enforce debt, which is taking control of the business to try and either sell the business as a whole or sell the assets piecemeal or operate the business in order to get your money back. So some of the issues that do come up is when you're trying to get your money back in a cannabis space is, well, what is your collateral? Like, what are you actually allowed to touch? So for and what are you actually allowed to sell? So for example, the cannabis, if you're dealing with an LP or a retailer in that regard, especially in Ontario, the license itself, it's not clear, it's expressly not transferable in the retail context, and it's highly unlikely, the act is silent on it, but it's highly unlikely that a retailer, a licensed producer's license can be transferred to a third party, and practically speaking, it's impossible because Health Canada on the back end can just, if they don't like who you're dealing with, who the purchaser is, then they're just going to terminate that license for one reason or another. Another point is that an organization cannot have possession of flower. So when you appoint a receiver, they're not a licensed producer. They don't have a cannabis license, so they don't have the ability to actually possess the flower or sell the flower to anybody, including another licensed producer. So you can't really look to the flower. And in the examples that we've seen, Health Canada has required the destruction of whatever flower is in the distressed business. So again, when you're looking to get paid back, and if you're lending and you're in factoring in the value of the collateral that you're lending against, if you're factoring in the license, the value of the license and the value of the flower, you might find yourself in a problem at the back end if you ever have to take over and actually take an enforcement step to find yourself repaid. Also, another thing to think about is during a loan, the Health Canada actually has broad powers to seize assets in the event of a violation of the Act. That includes, obviously the flower. There's one example right now, a famous one of Can Trust, where they were, growing illicit or I don't know, in contravention of the Act. They were growing flower that they shouldn't have been. And that got subject to seizure proceedings. And they also have the ability to seize, the equipment that you use. So let's just say, in an example, that the contravener was, hiding flower inside the equipment or under the equipment that could be subject to your collateral and otherwise may have been able to be sold in a normal process, is suddenly stuck in this proceeding by the government in their investigation in the context of them enforcing the Cannabis Act. And another thing that to think about is what is the effect if someone were to appoint a receiver or commence proceedings. You usually start with what's called a stay of proceedings, so it's like a pause button, stops anyone from doing anything to allow the company some breathing room to figure itself out and restructure its affairs. Some of the issues that you face are what is the from a legal perspective, what strength and teeth does that stay have in the face of Health Canada taking steps? And we think very little. So from that perspective, when I say what is your collateral and what are the issues you face, what you really need to be thinking, what is this stuff worth? And when I'm lending, how much money am I lending? Because if I need to get it back, what can I actually look to get paid back? And what do I think that is? That's probably your real property. That's probably the building upon which everything, the facility is constructed, the building that's constructed on the property. It's probably, assuming the Health Canada hasn't seized it, it's probably the equipment, the actual, like the lights, the growing systems, the infrastructure, that type of equipment. but it would probably is most likely not is your actual flower and your actual license. So those are, when you're lending, you shouldn't be factoring those in your lending decision at the front end. We do see some potential wiggle room if in a situation where you have the support of Health Canada, you have professionals in place that know what they're doing, and you have some credibility that you can gather the support of Health Canada and to help facilitate the restructuring of a business. There is potentially some leeway that you might be able to realize on assets, but in terms of a lending decision at the front end, we wouldn't advise to bank on Health Canada playing ball with you in an enforcement scenario at this current circumstance.
So it sounds extremely risky.
Well, it's risky in the sense that if you're lending against flower, it's very risky. If you're lending against a license, it's very risky. If you're lending against the other things I mentioned, equipment, to me that sounds more like traditional financing, with some added risk because Health Canada has these powers to seize property that you might otherwise face in a typical industry.
So would you say, from a strategy standpoint, in order to mitigate the risk, it's more rather you have to be a lot more strategic in what you're actually lending against?
Yeah, exactly. You have to be very careful and really do your due diligence in terms of what you're lending against and what the value of that collateral is, and making sure the money that's going out the door is consistent with the liquidation values of this collateral. It is, specialized products. It is specialized equipment. So there's a more limited buying group that's available, which could, depending on what it is, it's likely to depress the price of something when you have a limited buying group. One strategy that I've seen that we saw in this receivership case especially is a lot of times one security item that you could take is a share pledge. So you could take as security a pledge of the shares of this company, of a cannabis company, and then use that share pledge to kick out the current management team and replace it with your own. That creates some issues in terms of you need to make sure that Health Canada has signed off on those people. Otherwise, again, you could lose your license. And what are you doing if you don't have a license? But it's also, depending on what type of lender you are, that might impact whether you can take that step or not. We were at a financial institution doing a similar presentation, and going through that, it makes the thought is if you're a big financial, institutional financial institution, and like a bank, and you have operations across the world, chances are your executives might run into problems crossing borders if they are the owners of a cannabis company. That could be an issue for them. But in the context where I've seen it be reasonably successful here is where the ultimate lender is a private alternative lender, someone who's like a private equity company that's in the cannabis space already, and they have a portfolio of cannabis companies, and they're willing to take those risks because they're less concerned about these border issues and things of that nature because that's their business. I've seen them enforce on shares to try and take over and leverage their relationships with Health Canada to get relicensed and to get everything they need to run this operation and have a smooth transition. So, I mean, for the private debt market, I think there's maybe some more options and strategies to be creative. For a big financial institution, I think you're more restricted, just given the magnitude and the international scale that you're dealing in. So I think that those are some strategies that you could use depending on what type of institution you are and what you're trying to accomplish, what your end game is.
Awesome, that's great, and I think that helps even set expectations for the cannabis companies, when they go into these situations and look for lenders. I want to thank you for your time. We do have to move on to our next panel.
Thank you.
Thank you.